Hello and welcome. I'm Malcolm Packer from Kidney Cancer UK, and today we're going to be talking to Jameel Qureshi about his experience as a kidney cancer patient. Hi Jameel, would you like to introduce yourself?
Hi, Malcolm. Really happy to be here and talk about my experiences, and I hope that this really helps other patients going through something similar. So yeah, my name's Jameel Qureshi. I'm 35 years old. I live in the Midlands, and I had a partial robotic nephrectomy in September 2022.
Thank you. First of all, thanks for sharing your story with everybody. It's going to be a great help to everybody. And tell me, before your diagnosis, what was your life like? Are you active? Were you working? Do you have a family?
Yeah, so my job is I work as a software engineer at a software company. So it's a very sedentary job. And I did, try to keep an active lifestyle, which is often easier said than done. But I was going to the gym, 2 to 3 times a week, doing weights, going for walks at the local park with my family. So I have a 6-year-old. I'm married as well. So it was, just a normal working family parent life, really. Nothing that, struck me as anything that I lived or did differently that could lead to something like this.
So what made you go to the doctor then? And how did you first find out you had kidney cancer?
Yeah, so it's I think the way it kind of came about was I just come back from the gym, and I'd noticed these abdominal pains in what I would classify as the appendix area. So that's the right-hand side of your tummy.
Mm-hmm.
And I went to the GP first, and the GP said, look, it looks like maybe just to rule it out, it might be appendicitis, but take yourself over to A&E, and the staff at the A&E did a scan, and actually what they then said was the right hand side actually looks completely fine, and they started asking me questions about did I feel anything on the other side, on my left hand side, which at the time I was a bit surprised, and I was thinking, why are they focusing on that side? There's absolutely nothing going on there. And they arranged for a CT scan, and even at that point they didn't really tell me anything. It's only that they said, well, okay, your appendicitis is fine, there's nothing wrong there. We seem to have caught something on the left. We're not sure what it is, but we're going to refer you to a urologist. And off I went over to the urologist, who then said, actually, it looks like there's a suspicious growth. So he didn't even use the word tumor at that point. It's only when I got the letter later on that said, okay, it's a 3-centimeter tumor. I think he classified it as a Bosniak 3 cyst on the left-hand side. And yeah, I mean, it was, honestly, I was expecting to turn up there, and I was expecting the consultant to say something, I don't know, like, oh, maybe there's a muscle tear, or maybe there's something else. I really didn't expect it. So it really hit. And actually because I didn't expect any news, I didn't even take anyone with me. So I was at the appointment on my own. So I think it was a massive shock. Being 35 years old, you don't really expect to hear that you're going to get a cancer diagnosis.
So when you got the news, how did you handle it? How did you feel?
Honestly, it was almost like this numb feeling, like almost like you just don't really know what happened. How does a simple I have a pain in my right hand side turn into, oh, by the way, you have a tumor in your kidney? So I even thought, oh, surely they've got it mixed up with someone else. It's just very unusual at my age to hear it. But yeah, I mean, I think when you think of the different stages of grief, you have the anger, the denial, and then soon at the end you get to the acceptance stage. So I think eventually I just needed to recognize that, okay, that there is something there that shouldn't be there, and it is what it is, and we had to do something about it.
So you've been told you got kidney cancer. What did they tell you what the next steps would be? Where did you go from there?
Yeah, so as a young patient, I was offered actually several different options, and in no order of priority. The first option that was given was, look, it's small. We could do nothing about it now, and we just monitor it on a yearly basis and see if it's growing. Usually, with these, what the consultants told me was, with these types of growths, it's a slow growing tumor, but it could, at any time decide, oh, I'm gonna, go crazy and start to expand. So that option one was do nothing and monitor and take action if it did become into something of a serious problem. And then option two, obviously, was surgery to get it out. And because of the nature of the position of where it was in an awkward position within the kidney. What the consultant suggested was, look, a robotic one would be better because it would be, much more easier to get to and much more maneuverable with the equipment that they use. So, I mean, when I was given those options, I immediately said, look, the thought of something that shouldn't be there is not really particularly great. So I don't think waiting and doing nothing about it would suit me. So I just said, yeah, let's go ahead with the surgical option. At least, I'm young, I can handle it. I can, it's going to be painful, I'm sure, but at least my body will be able to recover faster and deal with the after effects as well.
Yeah. Were you told about any other treatment options apart from surgery? Were you offered like ablation? Any discussions on that area?
I didn't at the time. I didn't know, what would be the treatment options for a kidney cancer. So it didn't really occur to me until I got home and I kind of did my own little research. I had to call back actually the consultant to ask. And, in all fairness, he was really nice. He explained that usually with these types of tumors, the Bosniak 3 type cyst, that they don't recommend any other treatment other than surgery to remove it. Plus, he said it was small and they seemed to have caught it early, which, I think amongst all these things is a positive to think about, because if nothing would have happened, if I hadn't turned up to A&E, it would have, continued to grow, it would have continued to become bigger and, perhaps got to a stage where there would be no treatment available. So yeah, I was explained, but because of the nature of the way it was, surgery seemed the best option there.
Okay, so surgery was to move it. How long was the wait before you went in for surgery?
So I was given my diagnosis in March of 2022, and my surgical procedure took place in September of 2022. And initially, I was actually referred to another specialist hospital that was equipped to handle robotic procedures. And the waiting period actually was very long. I was told it was, some 6 to 12 months even, which, at the time I questioned it and I said, look, is it really safe waiting that long? And the consultant assured me it's, we will keep monitoring it anyway. And this being a slow growth, we have the leeway in the time to get the procedure done.
Did they give you any reason for that long wait?
Yeah, I did ask, and they said just it's because of the COVID backlog from a couple of years ago. So when I was put on the waiting list, they told me they had patients from 12 months ago that were still on the waiting list. So I think there was a lot of anger at the time in my mind, because I was thinking, what, I should be entitled to treatment. Why is it taking so long? And discussing it with my family, we even decided actually to get on a waiting list for the other surgical procedure option, which would be open surgery,
right?
Which had a longer recovery time, but I just couldn't deal. The longer the wait was becoming, the more my mental health was degrading and the more I was really suffering in my everyday life. And I think just through a series of coincidences that I was given a date for the open surgery, and then as I actually got closer to the open surgery date, they told me that particular hospital just started doing robotic procedures as well, and would I like to go on that? It just meant extending it by a further 2 weeks, which was a no-brainer for me. I said, well,
Yeah.
I've been waiting 6 months already. I'm happy to wait 2 weeks. And in hindsight, having been through the procedure, I'm much grateful that I did, wait those additional 2 weeks for the robotic procedure, because the recovery time was definitely much quicker for me.
Yes, it is. There's no doubt about that. How did you deal with the weight and that anxiety leading up to your surgery?
I think the biggest challenge really when you're waiting for a procedure is, for me personally, because of the long wait, as I said, I was, filled with a mix of emotions, like, a lot of anger really, and a lot of frustration, because I just wanted to get it done, and I even considered going private, but, I just couldn't do that. And then when you finally get the date and you lead up to the date, you then realize, oh, you've been so caught up in the anger and frustration phase that you now have to very quickly transition into, mentally prepare yourself for the surgery. So I think, reflecting back on it, I wish I had, just accepted the fact that, okay, things are the way that they are. We are grateful that we actually do have an NHS and it's a health service here that's world class and that can look after you. It can be frustrating, yes, but I think accepting things the way that they are would have certainly been beneficial for my mental health, at least. I think for me, the biggest struggle leading up to the surgery was just frustration, anxiety, and mental health was really terrible at that point in time.
And how did you deal with that? How did you get yourself through that and keep it under control and keep focused on the prize, so to speak?
I think if I had to be really candid, in reality, I don't think I did really deal with it very well. I mean, certainly my family and my wife will tell you the same, that I was just, there were times when I just had to say, look, just leave me alone. Don't, it's best. If you try and make me feel better, I'm just going to react in a way that's not going to be beneficial. And, I think it's just, yeah, I mean, personally, I don't think I dealt with it very well. I think it's just something that, I did eventually get to the acceptance stage and get to the stage where I realized, okay, I just, have to accept things the way they are. And it just so happened I got the date for the surgery at that moment in time. So in all honesty, and at the time I thought to myself, why am I being like this? I was being really harsh on myself. And I think on reflecting back, it would have been beneficial to be a little bit more mindful, to think that okay, you have been given a diagnosis. It's okay to feel the way that you feel, and it's normal, and it's part of that journey that you have to go through, and not beating yourself up about it and making yourself feel even worse.
Did you seek out any support? Did you have any support? Did you know of any support?
So I think it's a very good question, actually, and what is available really out there. When I say out there, there's several different online support channels that are available, right? We have obviously Kidney Cancer UK, we have the Macmillan Group, and we have Cancer Research UK as well. And there's a lot of really great online material. But I think in hindsight, what would have really helped me would have been just talking about the feelings that I was going through, and just having someone listen, which I didn't do at the time, because the way I was kind of dealing with it was, let me keep myself occupied with work, because at least if I work, I'm busy and my mind will be off things like that. But then, the evening comes along and you start to, I mean, it's human nature, right? You go on your phone and you start to Google these things, and then you always think of the worst case scenario with these things, and all the feelings of anxiety, anger, frustration, they just creep back in, and you almost become into this vicious circle of just helplessness, really. So I think, for other people who are going through this, I would, as I said, I didn't do it, which I wish I had done, is to just talk about it. And it doesn't have to be with a family member. It could even be a friend or even an outside person that just has to listen, really. They don't even have to say anything back, just listen.
Yeah, we have a counselling service as well for that as well. And we've also got our support line as well, which I'll give some, actually the details are up in the corner up there. And so, if anybody does need that sort of support, then please do get in contact with us. But you're feeling you once you had your time for your surgery, did that alleviate the mental pressures and that whole thing, or did you still go into surgery thinking?
No, I think it definitely alleviates, because you have a milestone that you can start to focus on, and when you don't have that milestone, you're not able to mentally gear yourself up and physically get ready for it. You're almost in this phase of limbo where you're just sort of neither here or there. So I think having the date made a massive difference, even though it was the procedure for the open surgery for me. That really helped a lot, because that gave me a target that I needed to focus on. So I was able to get my life in order in terms of, getting physical activities in, and having that data, that I said, really helps with the mental preparation, because okay, you can start to look at what do I need to do in terms of after the surgery, how do I prepare things at home? Is there things that I need to sort out at work? So that really helped, having the date and having that milestone.
Good. So you've got your surgery date, you're upstairs packing your bag. What is the process from packing your bag? What would you recommend putting into your bag? You get to hospital, what happens when you get to the hospital to log to register, and then you're in bed waiting for the surgery? Just take us gently through the process of how you prepared, what things happened, and along that way, what the process was.
Yeah. So the first thing is that you will get a lot of literature material from the hospital, and by a lot, I really mean a lot. And it can be a little bit overwhelming, because you have a sheet that tells you about the anesthesia, you have a sheet that tells you about what to bring with you, you have another booklet that gets given to you. All of this is really useful material, by the way, don't get me wrong. But it's just something to bear in mind, that when you get given these things, don't be overwhelmed. It's something there to help you with. For me, the way I kind of looked at my preparation and the bag that I took was, I actually took the advice that other patients gave, which, by the way, was, again, super helpful. The videos on the Kidney Cancer UK webpage for the other patients that went through similar journeys. So I packed light. Some of the tips that were given by the other patients was, take some loose fitting clothes with you, because that'll make you feel much more comfortable. Take a phone charger with you, take your headphones, so that, if you're in a shared ward with other patients, that you won't be disturbing them, because people might be sleeping during the daytime. People might be not sleeping during the nighttime. It's different experience for every patient. And of course, a gown and slippers, so that you can get yourself ready. And once you arrive at the hospital, it's depending on when you are having your procedure, whether it's morning or afternoon, the hospital will let you know at what time you need to come in. And once you're there, there's a series of checks that they will do. And believe me, it's good that they are doing those checks, because you're having a major organ taken out. So there's a lot of, tell me your name, tell me your date of birth, and don't be frustrated by that. It's really to make sure that they're doing the right procedure on you. And really, the hospital staff are very, very helpful, very, understanding of the fact that you may be anxious, you may be nervous. They even told me, you look anxious, you look nervous, just, relax, take it easy. They gave me a room to myself, just to say, look, just take your own time. We won't put you with the other patients, just so that you can be a little bit more calm. And then after that, it was time for me to go into the theater, and then the last thing you'll remember is having the anesthesia going in, and then you're off to sleep, having the procedure done.
Okay, so there you go. You're asleep. Surgery's done. And how were things for you? We know patient experiences are different from person to person and hospital to hospital. So hearing your personal experience would be of great interest to people watching. So how was it following surgery?
So once the surgery is done, you wake up in a recovery ward where you get allocated a member of staff that's constantly monitoring you. Things to bear in mind, it's going to be normal to have a really dry mouth. I had a really badly dry mouth, by the way, so it's okay to just sip on some water. That'll help. For me, the water was quite cold, so I had to ask if I can have lukewarm water, because that helps with the throat as well, just to ease the water as it's going in as well. Yeah, I think for me, the experience was, I think the most difficult night was the very first night after surgery. Not because I was in any pain. The pain medication was very good, and the control was really there. For me, it was difficult because I had my catheter taken out before I woke up. So a lot of the staff were telling me, look, it's really important for you to pass some urine, so that we know that you're able to do that. You don't want it to build up. And in doing that, I drank so much water that I had to pass urine so frequently that I was constantly up. So I think I only got maybe 30 minutes sleep at any stretch given in time. But the staff was super nice. They never moaned to me about the fact that I kept calling them regularly, and that's also in the night as well. So that's often a difficult time for a lot of patients. The staff were really understanding of that. So I think the first night was the most difficult one. But in hindsight, that moving around, that constant getting up was actually beneficial, because you feel the gas that they pump in you in order to do the surgery coming out. You just feel a lot better in yourself as well. And then the next morning I was able to very, very slowly walk. So I walked my way to the bathroom, and had a little clean up, brushed my teeth, just change of clothes as well, just so that I could just start to feel a little bit normal again. And actually at that point in time they said, I think you're able to, you're walking, even though it's slow, it's fine to be like that. And they asked me would I like to be discharged, and I said, okay, I mean, if you guys think it's fine, then that's completely okay. And they said, yeah, it's better, because at least you'll be at home, so you'll be in your own comfort zone. So that second day I was discharged with some pain medication. So yeah, I think for me it was a relatively smooth journey. I think it's what really helped, as I said, was just getting up and moving around. I mean, you don't have to walk a lot, even if you just get up and sit up and stand up. That really is beneficial for the body.
Okay, did you have anything when you left hospital that really helped you on the journey home? Anything in particular that you want to talk about?
Oh, that's a great question, Malcolm. You reminded me, because a lot of the patients that went through the procedure gave a wonderful tip to take a small soft pillow, or at least have a soft pillow with you. Because when you're in the car and it's a bumpy journey back home, the seatbelt can be in a position where it's not very comfortable. So having a soft pillow that you can just gently hold against the site where you did have the surgery, it really helps. It eases the bumps. It helps with the seatbelt sitting in. That was a really, really big tip, I think.
Yeah.
Something that I would really recommend to the other patients as well.
We do actually have a partnership with a lady who makes things called butterfly pillows, and you can get them from our website. So I'll put the details of that just below me. So if anybody wants to have a look for those, that's and many people use them, and many people say how useful they are. So that's fabulous. So you're on your way home. You're out of hospital. The deed's done. How did you feel over the next few days?
I think mobility is going to be very slow. So for me, I accepted that. I knew that. I actually, what I did recognize, and one of the things that really helped me was there was a gentleman by the name of Declan who posted a series of blogs
Yes.
on the Kidney Cancer UK website. And actually, I could see in his demeanor, in his face, that, by day 2 or day 3, he was, definitely much more happier. The mindset was a lot more positive. So in my mind, I geared myself, okay, the first 2 days are going to be tough. You got to man up, you got to deal with it. You're going to have to suck up, take the pain medication, whatever is needed, just deal with it. And I think that was definitely true for me as well. By day 3, I was, still sore. Don't get me wrong, the soreness will be there, but you're definitely a lot more comfortable than you are on day 1. So focus a lot more on walking around. For me, I actually just, I had my headphones in, I'd go into the garden and just, slowly trot up and down. And by slow, I mean, I was really slow, by the way. So I wasn't walking fast at all. And just try and take it easy. Just don't stress yourself too much about things that you can't do. Be mindful and accept that you've been through a journey which has led to a major surgical procedure, and it's okay to feel down and out. It's okay to feel sore. It will pass. It does get better with time. And yeah, focus on just taking it slow with your diet as well. The other thing that actually helped, I just remembered, because of the moving around, it really helps with things like your bowel movements, because you get pumped with anesthesia. There's a lot of fear in patients that you might get constipated and struggle with that. And I can tell the moving around does help, because I felt just naturally the need to go, and it was fine for me. The hospital did give me some laxatives, which I took as well, as they recommended. So I'm sure that also helped as well. And yeah, I think with each day, you'll feel much stronger than you did the day before, and the soreness does get better with each passing day.
Well, it's great to hear you have such a smooth journey, for the want of a better expression. Obviously, there are people that have had bumpy roads as well, and are not as fortunate, let me just say, as you in the recovery. So, hopefully some of the information that you've given will help them in their continued journey on things. Are there any bits of advice that you give to patients on what they could do to benefit from a fast recovery like yourself?
Yeah. So having been through it, I think the one thing I did do was move around as much as I possibly could, and just gentle walking around the house. It doesn't have to be outside. That really helped. One thing I didn't do, which the hospital staff did tell me that I should do, is to remember to take some deep breaths. So I was given a device, I think it's called a spirometer. The concept is that you use that device to take a very deep breath, at least once or twice in an hour. And the reason they recommend to do that is it'll help to reduce the buildup of any phlegm in your throat, which means it will reduce the need to have to cough, which I can tell you it's fairly uncomfortable if you need to cough. And it's even more uncomfortable if you need to sneeze. So just bear in mind that, try and avoid things around the house or even outside that could trigger any sneezing, because that's really quite uncomfortable to have to go through. So I think, yeah, just the advice I would give is, just take it easy, try and be mobile. Remember to take those deep breaths in, which, will help with not having to cough either. And yeah, I think just take it easy more than anything.
Great. So, how are you today is the question, and what are your plans for the future?
So I'm now, it's been 3 weeks since I've had my surgery. I'm actually back to work this week.
So where are we? We're at the 19th of October, just so anybody watching this in the future, just so they're aware of our timestamp on this.
Understood. So yeah, I'm back to work this week, albeit, as I said, I have a pretty sedentary job working from home. I can get away with working from home quite often, most of the times. It is difficult because sitting down in one position is the soreness and the weird feelings tend to build up. But I do what I can. I want to focus on just getting back to a normal life as quickly as possible, the life that I had before. I think having been through something like this, you start to have a bit more appreciation for the finer things in life and understand. And I think it really gives you a perspective of what should be your priorities in life. For me, if someone asks me, do you plan to live your life any differently? I mean, no, not really. I don't plan to drastically change what I was doing before to what I am doing now. I still continue to when I can, I will start resuming going back to the gym. But I think, having been through a journey like this, I'm sure for me, it'll mean, yearly CT scans to monitor the growth and see if it comes back. It could come back at any given moment in time. I think I'll be better prepared if that does happen. Hopefully not, but I think it's accepting that this is part and parcel of your life, and it's something that we all will, may have to go through. And I think with the advances in technology, especially for me, I didn't even know anything like this. I was there, I had no symptoms. It was totally incidental finding, which can shock people. And I think it's just important to recognize that there is treatment out there that's available, and there are support mechanisms in place to help you with that. And it's, I would really advise to take advantage of those, which is something that I didn't do, which I wish I had done, really, in all honesty. But yeah, I'm going through something like this. I'm very grateful for the support I got from my family, my parents, my wife, my siblings. The exemplary care that I got from the NHS, despite the frustration of the long waiting time. I think it was, seeing the way they cared for me and looked after me, it was really nice.
Good. Looking back, a lot of people would like to live their life in retrospect, and it would change so many things for us. Now, you've got the advantage of being able to possibly help people who are about to start on this journey, to help them maybe live their life in retrospect, and just tell us what you might change if you knew what you knew now.
I think that when I do reflect back on my journey, the one thing that I did really terribly was accepting what was given to me as news, and I didn't really take advantage of the fact that there are support mechanisms available, like counseling services, which is, I think if I had done, I would have been over that initial grief stage, as in a much faster timeline, and I would have got to the acceptance stage a bit quicker, which would have really helped with the mental health preparation, because you have to remember that it's not just the news that you've been given, but it's also the frustration that you may face with having to wait for your surgical procedure or your treatment that you are enlisted for. So it's almost like a double whammy. You get the bad news, and then you get told, oh, you have to wait as well to get it rectified. So really, I think, in retrospect, I didn't take advantage of those support mechanisms. And I would really recommend you to do that, because as a person, you can prepare physically, right? You can go for walks, you can get your, cardiovascular health up, you can get your diet in shape and prepare physically easily. The mental preparation and the mental health is not so easy. And for me, it was, even now, I think I'm in a better position now, but I think I would recognize that my mental health would probably be the first to suffer from compared to my physical health.
Thank you for that advice, and I'm sure that people will be people starting on their journey will take that on board and be of great use. So thanks, Jameel, for your time. We really appreciate it, and we wish you a speedy recovery to full health, and all the best to you into the future.
Thank you, Malcolm. And I really hope this helps other people who go through the same experience. I think my message to you would be strong. There are a lot of us that are going through something similar, and reach out through the online channels. Wherever we can, we will try and help. But, be strong, and you will get through the difficult patches, and it does get better.
Fabulous. Thank you. So if you are watching this and you need any further support or information relating to any matters around kidney cancer, please visit our website at kcuk.org.uk, or call our free support line on 0800 002 9002, where you can talk to one of our health professionals who will talk you through any issues that you might be having, or they can give you some details about our counselling service as well. So thanks for watching, and once again, thanks, Jameel, for your time and sharing your experience. Thank you.
Thank you so much, Malcolm.